Hey guys, I'm Dr. William Summers and want to thank you for watching video 7 in my series, Weight Management, A Class with ACT. I want to talk to you about who might consider medicines for weight loss. Body mass index, BMI, is the term used to categorize our weight status. This involves putting our weight in kilograms and our height in meters into the formula weight over height squared. If your BMI is 19 to 24.9, that is normal and represents about 25% of our population. 25 or greater is considered overweight, 27 is more overweight, and 30 and up is considered obese. 40% of our population has obesity. Here are the prescribing guidelines for eligibility to consider any weight loss medicine. 1. If your BMI is 27 to 29.9 and you have at least one comorbidity, which is something wrong with you because of that weight. This list includes hypertension, type 2 diabetes, high cholesterol, sleep apnea, fatty liver, and others. If your BMI is 30 or greater, you're eligible for consideration based on your BMI alone. Body fat index, a BFI of over 25 in men and 32 in women, is considered obese. There are instruments used in provider offices to measure this, but the most accurate way is a DEXA scan, which is required in all clinical trials measuring BFI. We measure abdominal girth in inches, where greater than 40 inches in men and 35 inches in women is considered obese. In my opinion, this is the most important measurements where reductions will reward the highest quality of life improvements. I want to talk also about FDA-approved medicines and common off-label medicines used for weight management. Of course, any medicine is used in conjunction with health style changes involving both dietary and physical activity, sustainable choices. In 1959, Phentermine was developed, and clinical trials showed 5% total body weight loss over the 12 weeks studied. 5% remains the benchmark for clinical trial success today for medicine studied for obesity management. That was 65 years ago, and very few medicines have been able to demonstrate 5% total body weight loss. And several that did, and we thought were safe, proved otherwise. GLP-1 medicines were initially released as daily injections, liraglutide, in 2014, and 9% weight loss was demonstrated, almost doubling 5%. The GLP medicine was reformulated and made into a smaller molecule so we could get more inside our brain. They were also made into a weekly injection instead of a daily injection, semaglutide, and these demonstrated 18% weight loss. And then GLP-1 and GIP were combined, tirzepatide, and demonstrated 22% weight loss. Adding glucagon to this, known as retatrutide, triple G, is demonstrating 30% weight loss and will be released soon. Adding amylin to semaglutide demonstrate 20% in ongoing studies. All of these have greater safety profiles and far exceed 5% total body weight loss set in 1959. I want to talk about the other FDA medicines approved for obesity management. First, a controlled drug means that substance could have potential addiction or abuse, and we're all aware we have a controlled substance problem in this country. There are national guidelines and individual state guidelines for prescribing controlled substances, which cannot be modified by any prescriber. The PDMP, a HIPAA-protected state record of any patient on controlled medicines, is invaluable, and I check it 100% of the time for patient safety for every patient in my clinics. There are 2 controlled meds for obesity. Phentermine was the first drug approved for weight loss in 1959. It is a stimulant and goes into the brain to turn off hunger. There are a host of concerns regarding blood pressure, heart racing, insomnia, and psychiatric illnesses. In my observation, patients create starvation patterns with weight loss too disproportionate with increased muscle loss. This medicine was only approved for 3 months use. This medicine was never intended for maintenance. Generally, the appetite control on stimulants tapers rapidly as tolerance develops. And I see a quick and vengeful weight return in most patients who use it, and they return with a slower metabolic rate because of muscle loss. This is the only medicine we had on the menu to consider for years. Everyone has heard about it and often ask for it, just especially because they are unaware of the other medicines on the menu. There are long-term studies being currently conducted to evaluate this medicine further. Stimulants may or may not raise your blood pressure, we measure with an arm cuff, but they can and do raise blood pressure in your lung vessels. When there's more pressure in your lungs, the right side of the heart has to work harder and doesn't like to do that. Pulmonary hypertension and right-sided heart failure are some primary endpoints being currently studied in ongoing trials with Phentermine. Let me tell you about Topiramate, Topimax, before I get into the next controlled medicine. Topiramate was FDA approved for patients who have seizures in 1966, and in 2004, Topiramate became FDA approved for migraine headache prevention. Weight loss was an observed side effect, and we now know that Topiramate hits a button in the brain which helps us not be hungry. It has been around for a while, and its safety profile is well known, and this is often prescribed off-label for weight management. When used for patients for weight reductions and the patient happens to have migraine headaches, this is a twofer. It is taken at bedtime, and improved sleeping has been reported, which could be a threefer. You cannot take Topiramate if you have ever had a kidney stone. This medicine can make your food taste weird, dyschezia, which may not be a terrible thing in this context. Like any medicine, it can cause nausea. It can make patients feel pins and needle tingling sensations. Overall, it is well tolerated, and most common reason patients stop it is because it can create brain fog. Enter Qsymia, FDA approved for weight loss in 2012. Some smart people decided to use a much lower dose of phentermine and add Topiramate to it. And together, 1 + 1 = 3. The Topiramate makes the phentermine stronger, and the phentermine makes the Topiramate stronger, and this is a healthier choice for the heart and can be continued for maintenance. The cost, about $100 a month. National and state guidelines will apply with any phentermine prescription. Branded Qsymia is preferred in my opinion. It is easier for a patient. The cost is just an overwhelming hurdle, and for this and most of these medicines, prescribers often prescribe the two medicines in Qsymia separately to contain cost. In the Journal of the American Medical Association 2019, there was a study where all FDA-approved medicines were lined up like a horse race, and Qsymia won first place by a nose finish. With the newer GLP-1 medicines exceeding 20% weight loss, the GLP meds would today win by a wide margin. Let's talk about bupropion. This dopamine button hitter came out in the 90s to help with improving mood. It was called Wellbutrin. It helped people stop smoking, and it was renamed Zyban, one medicine with two names. Let me talk about the brain a minute. The first part of our brain that developed, the primitive brain, is where our on-off hunger buttons live. The next developed part of our brain is where we have the feels and reward zone buttons. This higher developed part of the brain overrides the primitive brain. This explains after meal when you have a very full feeling and then see dessert and get immediately hungry for it. Bupropion works in this part of the brain, and Dr. Sinclair in the late 80s treated his patients who had alcoholism with a medicine called naltrexone, which works in the reward brain, blocking opiate buttons. So in 2014, some smart people put bupropion and naltrexone together and created Contrave, which became FDA approved for obesity management. It shows more efficacy in patients who feel they are emotional eaters. Providers sometimes write the two ingredients separately due to cost. Again, branded is preferred, but continued monthly cost strains are real. Anyone with a history of seizures cannot take bupropion, and headaches and nausea can be common side effects. Slow dose titration is recommended. Naltrexone blocks opiate buttons in the brain, so anyone taking chronic pain medicines cannot use this because of potential severe withdrawals. Let's talk about Metformin, which has been used for patients who have type 2 diabetes a long time. Unlike sulfonylureas, patients lose weight on Metformin. This medicine is approved for ages 10 years old and up for type 2 diabetes and is the most common off-label medicine used for weight loss. You cannot take Metformin if you have kidney disease. The starting dose of 500 milligrams twice a day is rarely tolerable, so slow dosing is helpful here. This medicine is cheap and can be used if necessary with other medicines, including GLP-1 medicines. It will not lower your blood sugar. The weight gain from many prescription medicines can be offset with the use of an addition of Metformin. I want to mention a thing the FDA approved for weight loss created in 2019 by smart doctors who still work in obesity research. It is called Plenity. This is made from a plant-based hydrogel, which is put into capsules which you take before meals along with a bottle of water. This plant hydrogel granules absorb water and create what I call water balloons that fill the stomach and GI tract. And as they move downstream, the water is reabsorbed by your body, and the fiber left, like everything else in the colon, is eliminated. Nothing from Plenity goes into your bloodstream. There are minimal side effects. But since this stuff does not go into the bloodstream, it cannot be called a medicine, and instead, it is called a medical device. You swallow 2 capsules with water before each meal. It's pretty cool, and you may want to look that up online. There is an online pharmacy, and this medicine runs about $100 a month and delivered to your mailbox.
The last FDA-approved medicine to talk about is Xenical, orlistat, which was FDA approved in 1999. Lipase is a pancreas enzyme that breaks fat that we eat into small pieces, so the small fat pieces can be absorbed at their intestinal gates. Xenical blocks lipase, so fat cannot be broken down and absorbed. That sounds great, except our large intestines does not like these unbroken fat pieces sent there, and this medicine causes severe GI issues. The manufacturer cut the dose in half and sold it as Ally over the counter. Xenical does seem to have more tolerability and benefit in pediatric populations.
I honestly hope this series gives you an informed overview. My intentions are to help educate and hopefully inspire style choices which could create a higher quality of life for anyone. In my love of quotes, I'm not sure who said this one, the best physicians give you their hearts before their prescription. I'm trying to give you my heart. Thank you for watching Weight Management, a class with ACT. My acronym for All Come Together for support and mutual respect, seeking solutions with equal access for all of us to enjoy our healthiest and highest quality of life. Thanks.